My name is Jurgita Ribinskaite. I'm General Secretary of Association Mentor Lithuania.
And what does Mentor Lithuania do?
We are a drug prevention agency, so we focus on the drug prevention field.
Okay, so you've been interviewing Kinship carers over the last couple of years and talking to them about their circumstances in Lithuania. What have they told you? What have they said about their lives?
Yeah, we found out that kinship carers, maybe they really very passionate, speak about their love to the kids, and they really have very huge responsibility. Their concern is very big, but also they have very hard feelings, like feeling guilty for their life their children had, feeling ashamed for their education they deliver to their kids. So they have strong feelings that makes them hard to be a good parent, good kinship carer.
Yeah, and so did they talk about? I think I remember from reading your news analysis that they talked about particular difficulties of when the kids were growing a little bit older, and
yeah, because that was our focus. We mainly tried to interview those kinship carers that they care about the kids that in the age from 7, let's say, years old, and then they are trying to, and then the trouble starts. They say, even one kinship carer said, "I'm afraid when my daughter crossed the street. I'm afraid when she speaks with someone stranger in the street. I'm afraid of everything." I mean, of course, the usual parent is also concerned about the things, but the kinship carer is afraid that the kid will do the same mistake as his father or mother did, and he sees everything through like a double, exaggerate every situation. And sometimes they don't know what to do, so they go to very extreme behavior. Like we had kinship carer who was closing her kid in the room in the evenings, or even cut her hair that she would not go to discotheques or meet other boys or other friends. So they come into very extreme situations because they want to make sure that nothing will happen again. And it's definitely those people they just mislead. They just need the proper information.
And so, what have you done over the last year to try and think about what is it that you think is going to work?
Yeah, we did after this analysis. What we understood that though the kinship care is concerned about their kids, they also have their personal problems to solve. So we adopted the parent program for the kinship care's needs. So it was 5 seminars with different topics. Well, we did focus group before to realize what the really needs of what the really needs are, and it was really successful training. Though we had small group of participants, so it has good side because everyone had a chance to discuss their own situation, and we think we can make this as a training model for other kinship carers, and then based on that, we also will we will writing a manual with our partners also to help kinship carers to understand better psychology of the kids, to understand better what's happening in this age when the kids are getting more independent, when he's already getting out of the home, and how to trust the kid, how to let the kid go and not to be stressed in every moment, and maybe to say that, okay, you are responsible as a kinship carer, but you don't have to overdo with the responsibility. Just, they just need to relax a little bit, I think.
Yeah, no, I think that's really comes across, is that need to find a way of communicating with your grandchildren as they grow up, or your nephew or niece or whoever it is, your child even as So my final question really, at this point anyway, Jurgita, is, you've been working on this for a couple of years now, as I said. Have you got any messages that you think at this point, right, if I was in front of the Prime Minister of Lithuania or the President of the European Union, what would you be saying to them about this?
I would just try to say that those families exist, because I think that they are kind of forgotten families, as I said, or hidden families. First of all, because they don't want to be open, because it's for reasons we already discussed. And I want to say to those officials that those families also exist, because especially in Lithuania, sometimes our government wants to make, the family is only father, mother, and their own child. So I want to say that those families also exist, and they are trying very hard. Sometimes they try even harder than that, let's say, normal family, to be good, to do their best, and that effort should be appreciated. Because what happens is sometimes that they feel like they've been looked like someone who needs the support, financial support, and that's humiliating. They just need to be recognized for their hard effort to make those kids, because in the end of the day, they are saving the government money, they are saving government, job, so they should be appreciated.
Absolutely.
And in which ways, it's you can find different ways to appreciate the work they do. But one of the things we have to face, to understand, just to count how many families like this exist. Because if their families are not officially taking the foster care, we don't even know. And I'm not going to venture now here the situation of immigrant kids.
No.
That's another big issue.
Yeah. Okay, well, thank you very much, Jurgita. That's really helpful. Thank you.